Cancer is one of the most common diseases worldwide, and its early symptoms are often so subtle most people don't notice them. But what if recognizing those signs could save your life? Early detection can make all the difference, turning a potentially fatal diagnosis into something manageable. In today's video, we're uncovering 10 surprising symptoms you might not even associate with cancer. Some of these could shock you, but knowing them could be the key to preventing something life-threatening. Stay tuned, because this information could change everything. Section 1. Unexplained lumps or changes to the skin. You've probably noticed a bump or mole on your skin at some point in your life. Some of these might seem harmless and fade away on their own, but what happens when these lumps change or don't go away? Unexplained lumps or changes to existing moles or skin lesions can be some of the earliest signs of skin cancer, and they often occur without any pain or noticeable symptoms. The most common form of skin cancer is melanoma, which arises from the pigment-producing cells in the skin. But other types, like basal cell carcinoma or squamous cell carcinoma, can cause similar changes. These cancers often present themselves as new moles or changes to existing moles in terms of size, shape, or color. A mole that becomes asymmetrical, develops jagged edges, changes color, or becomes much larger than it was before should raise red flags. Skin cancer can also appear as sores that don't heal. These persistent sores or lesions may bleed or crust over, but they don't seem to fully recover, which can signal cancer's presence. Additionally, as cancer spreads or metastasizes, it can reach nearby lymph nodes, causing swelling or the formation of tender lumps beneath the skin. The critical takeaway here is the importance of regular self-exams. Keep an eye on your skin for any new growths, changes in moles, or areas that seem unusually persistent. If something doesn't look or feel right, schedule a visit with your doctor. Early detection of skin cancer can make treatment far more effective. Section 2. Indigestion or difficulty swallowing. We all get indigestion from time to time. A spicy meal or a heavy dinner might upset your stomach for a few hours, and most of the time, it passes. However, when indigestion becomes chronic, or if you start experiencing difficulty swallowing, these symptoms could be a sign of something much more serious. Difficulty swallowing, or dysphagia, is a condition that occurs when the muscles in the throat or esophagus have trouble moving food and liquid into the stomach. This can happen for many reasons, but when it's linked to cancer, it's usually due to a tumor blocking or narrowing the digestive tract. Cancers of the esophagus, stomach, or intestines can cause tumors that obstruct the passage of food and fluids, resulting in symptoms like chronic heartburn, bloating, nausea, and even the sensation of food being stuck in your throat. If you're struggling to swallow, especially if this is accompanied by persistent indigestion or unexplained weight loss, it's crucial to seek medical advice. While these symptoms can be caused by conditions like acid reflux or gastritis, they can also point to something more concerning, like esophageal cancer or stomach cancer. Early detection in the digestive system can prevent cancer from spreading, so don't ignore these persistent signs. Section 3. Mouth sores that won't heal. Mouth sores are one of those common irritations we've all had at some point, usually caused by an injury or irritation inside the mouth. They can be painful and annoying, but typically heal within a week or so. However, when mouth sores become persistent or reappear frequently and refuse to heal, this could be a serious red flag. Cancer in the mouth or throat can disrupt the normal healing process of tissues. The rapid and uncontrolled growth of cancer cells damages the cells in the lining of the mouth or throat, causing ulcers or sores that don't heal. Not only does cancer impair the body's ability to repair these tissues, but it can also weaken the immune system, making it more difficult for the body to fight off infections or heal wounds. If you've had mouth sores for an extended period, or if they keep coming back without any obvious reason, it's time to see a doctor. In addition, if these sores are accompanied by other symptoms like pain when swallowing, difficulty chewing, or unexplained weight loss, it's especially important to get checked out. Early detection of oral cancers can significantly improve treatment outcomes. Section 4. Blood in urine or stool. Seeing blood in your urine or stool is alarming, and for good reason. It's one of those symptoms that should never be ignored. While blood in your stool can sometimes be attributed to hemorrhoids or other benign conditions, It can also be a sign of something more serious, such as colon, rectal, or bladder cancer. Cancer in the digestive or urinary systems can damage blood vessels as tumors grow and spread. In cases of colon cancer, for instance, tumors can ulcerate the lining of the colon, causing bleeding that mixes with your stool. In bladder cancer, blood in the urine might appear without any pain or other symptoms. The blood may not always be visible to the naked eye, but microscopic blood in the urine, hematuria, can still indicate a problem. If you notice any blood in your stool, urine, or even if you feel an unexplained sense of urgency when urinating, it's crucial to seek medical advice immediately. The most important point here is that even small amounts of blood should never be dismissed. If you notice blood in your stool or urine, even if it's just a tiny amount, don't wait to see if it resolves on its own. Visit your doctor for further testing to rule out cancer or other serious conditions. Section 5. Persistent cough or hoarseness. A persistent cough can seem like just a minor irritation, especially if you're dealing with a cold or allergies. But when a cough lasts for weeks, and it's accompanied by hoarseness or a change in your voice, it could be a sign of something much more serious, such as lung cancer or throat cancer. Cancer in the lungs or throat can cause tumors to grow and block the airways, leading to a chronic cough. In the case of throat cancer, these tumors can also affect the vocal cords, leading to hoarseness or a change in the tone or pitch of your voice. Sometimes, this type of cough can even cause a feeling of tightness in the chest or difficulty breathing. If you've had a cough that doesn't improve after a few weeks, or if it's accompanied by hoarseness that doesn't go away, it's essential to seek medical attention. This is especially true if you're a smoker or have a history of respiratory issues. Early detection of lung cancer or throat cancer can improve your chances of successful treatment, so don't ignore these persistent symptoms. Section 6. Unexplained bruises are a common occurrence for most people. Whether it's a bump on the arm or a fall, bruises usually heal after a few days or weeks. But what if you start noticing bruises that appear for no reason at all? Or bruises that seem unusually large or take much longer to heal? Certain cancers, especially those that affect the blood or bone marrow, can interfere with your body's ability to produce blood clotting factors. Leukemia, for example, is a blood cancer that affects the bone marrow, where platelets are produced. Platelets are essential for blood clotting, so when their numbers drop, it can lead to excessive bruising and bleeding, even from minor impacts. Other cancers, such as lymphoma, can cause similar issues, weakening the blood vessels and increasing the likelihood of bruising. If you find yourself bruising easily, or if the bruises don't seem to heal, it could be a sign of cancer affecting your blood or bone marrow. While there are many other reasons for bruising, this symptom should never be ignored, especially if it's paired with other signs like fatigue, weight loss, or unexplained pain. Section 7. Persistent fatigue. We've all felt tired at one point or another, but when fatigue becomes constant, when you wake up feeling just as tired as when you went to bed, it's a sign that something deeper might be going on. Cancer is one of the most common causes of persistent fatigue, and it's not just the result of the body fighting off the disease. Cancer cells are notorious for stealing the body's energy. They grow rapidly and consume nutrients that your body needs to function, leaving you feeling drained. As these cells multiply, they deprive your body of the energy it needs to stay active, leaving you in a constant state of exhaustion. This fatigue can be exacerbated by the immune system's struggle to fight off the cancer cells. In addition, many cancers release substances that affect your metabolism, disrupting the way your body processes food and energy. This can lead to significant fatigue, which doesn't go away even with proper rest. If you're feeling constantly exhausted and can't explain it, it might be time to get checked by a doctor. Section 8. Unexplained or constant pain. Pain is one of the most common warning signs that something isn't quite right with your body. Most of us experience occasional aches and pains, but when pain becomes unexplained or constant, it can be a sign of something more serious, like cancer. As tumors grow and spread, they can press on surrounding tissues, organs, and nerves, causing pain. Some cancers, like pancreatic cancer, can cause dull abdominal pain, while others, like bone cancer, can cause sharp, stabbing pains in the bones or joints. Some cancers also release chemicals that irritate the nerves, which can lead to persistent pain that doesn't improve with rest or medication. If you're experiencing pain that doesn't go away, even after trying over-the-counter medications, or if the pain seems to come from nowhere, it's time to see a doctor. Persistent pain should always be checked out, especially if it's accompanied by other symptoms like weight loss, fatigue, or a persistent cough. Section 9. Constant fever or night sweats. Fever is a natural response to infection. But when fever becomes constant or you experience night sweats regularly, it could indicate something much more serious, like cancer. Cancer triggers a series of changes in the body's immune system, leading to inflammation and disruptions in temperature regulation. This can cause persistent fever or night sweats that seem to have no clear cause. In some cases, certain cancers, like lymphoma, can directly affect the body's temperature-regulating mechanisms, leading to these symptoms. Night sweats can be particularly alarming because they often wake you up drenched in sweat, sometimes even in the absence of fever. If you're experiencing fever or night sweats that don't seem to go away, and you have no other obvious explanation, it's important to get checked out by a healthcare professional. Section 10. Sudden weight loss. Unexplained weight loss is one of the most common and sneakiest warning signs of cancer. You might wake up one day and notice that you've lost a significant amount of weight without making any changes to your diet or exercise routine. At first, this may seem like a good thing, but it can actually be a red flag. Cancer cells consume large amounts of energy as they grow and divide. This process can cause your body to burn more calories than normal, leading to rapid and unexplained weight loss. Some cancers also release substances that interfere with your metabolism, making it difficult for your body to retain or gain weight. If you've lost weight unexpectedly, even without changing your habits, it's important to see a doctor. Unexplained weight loss is a serious sign, and while it's not always related to cancer, it should never be ignored. Your body is constantly trying to communicate with you. The symptoms we've discussed today are signals that something may be wrong, and recognizing these warning signs early can help you take action before cancer spreads. Early detection is the key to successful treatment, and the sooner you act, the better your chances of survival. If you've noticed any of these symptoms, no matter how small or insignificant they may seem, don't wait. Reach out to a healthcare professional and take charge of your health. Your health is your most valuable asset, and recognizing these early signs of cancer can be the difference between life and death. Remember, it's always better to be safe than sorry. Stay proactive, stay informed, and don't ignore those subtle signs your body is sending you. By spreading awareness and encouraging others to stay vigilant, we can create a healthier, more informed world. Thank you for watching, and take care of yourself. We'll see you in the next video.